If you map the modern global health crisis, you find four dominant branches: obesity, type 2 diabetes, atherosclerosis, and cancer. While these conditions present wildly different symptoms in the clinic, they share an identical biological engine. They are all driven by chronic, low-grade inflammation. Medical science has definitively traced part of this inflammatory response back to our digestive tract. The specific foods we consume alter the bacterial composition of our gut microbiome, and an imbalanced microbial population triggers a systemic inflammatory alarm. Yet, even knowing that diet, bacteria, and inflammation are locked in this cycle, our current broad approach to healthy eating is failing to halt the rising burden of these chronic diseases. The problem lies in a massive research gap between clinical nutrition and the study of immune response. When treating illness with pharmaceuticals, doctors deploy microscopic precision to block or activate specific pathways. But in the field of immunonutrition, the clinical toolbox is virtually empty. Physicians often rely on blunt instruments like generic multivitamins or basic probiotic blends. We lack specific, targeted dietary therapies engineered to act directly on exact cellular receptors. Curious, deliberate, that gap is finally closing with the identification of a specific molecular bridge, the NOD1 receptor. By isolating this specific protein, researchers are elevating nutrition from a vague wellness concept into a highly targetable medical intervention. This diagram illustrates exactly how that bridge operates at a structural level. The protein floating dormant inside the cellular fluid is NOD1. It operates as a pattern recognition receptor within our innate immune system, essentially an internal cellular alarm. Its primary biological function is to detect microscopic bacterial fragments, specifically molecules known as IE-DAP. When gram-negative bacteria in our gut shed these fragments, they slip inside our cells and physically bind to the dormant NOD1. Detection triggers an immediate chemical reaction. The activated receptor rapidly recruits a swarm of specialized proteins, stacking them to form a massive active cluster. This newly formed cluster initiates a massive chain reaction. Chemical signals cascade away from the receptor and flow deep into the cell's central nucleus. The nucleus responds by commanding the cell to release a surge of inflammatory markers, directly damaging the localized tissue surrounding it. This rapid response system evolved to keep us alive during acute, life-threatening infections. But when modern diets chronically trigger this exact tripwire day after day, the resulting low-grade inflammation causes profound metabolic damage. The core revelation in recent immunonutrition research is that NOD1 sensitivity is not solely controlled by bacteria. It is directly dictated by the specific lipids in our diet. Saturated fatty acids act as a biological accelerant. They hypersensitize the NOD1 receptor, dramatically ramping up the inflammatory cascade even when bacterial loads are low. Unsaturated fatty acids produce the exact opposite effect. One specific omega-3 fatty acid, DHA, actively calms the cellular environment. Look at this comparative chart to see the exact mechanical intervention. On the left side, under saturated fats, NOD1 molecules densely pack together in a process called auto-oligomerization, leaving the alarm permanently armed. On the right side, DHA physically interrupts this packing. It disperses the molecules and effectively jams the alarm system, even when bacterial fragments are present. The fat profile on a patient's dinner plate acts as a literal physical switch, turning their cellular engines of chronic disease on or off. Moving from the cellular mechanism to the macro clinical view, NOD1 has emerged as a primary therapeutic target. Hacking this system offers a clear path for patient recovery. Modulating NOD1 activity has the direct potential to reverse insulin resistance in diabetics and halt vascular plaque instability in patients with severe cardiovascular disease. This introduces the clinical concept of personalized immunonutrition. Physicians could use exact dietary profiles engineered specifically to control a patient's individual NOD1 pathways. Targeted nutrition is transitioning from general preventative advice into a potent biological weapon designed to actively complement traditional drugs and surgery. Despite this promise, the current clinical reality is that NOD1-specific nutritional therapies cannot yet be routinely prescribed in hospitals. To close the research gap, scientists must clear immediate scientific hurdles, starting with fully integrated disease models and advanced clinical trials designed to prove these dietary interventions work safely at scale. The medical field also needs standardized immunoprofiling. Doctors must be able to accurately map an individual patient's baseline immune state before they can prescribe a precise dietary intervention. Ultimately, this research points to a clear vision for patient care, a future where the exact molecular architecture of our food is prescribed as a precision-engineered therapy, permanently deactivating the biological roots of chronic disease.